Have you ever thought about your spleen? Probably not. It's not as famous as your heart or liver, but this small organ, tucked neatly under your left rib cage, is one of your body's unsung heroes. However, when your spleen becomes enlarged, a condition called splenomegaly, it can signal some serious health issues. So, what exactly does your spleen do, why is it important, and how can you take care of it? Let's dive in and find out. The spleen might be small, about the size of your fist, but its job is huge when it comes to keeping you healthy. First and foremost, it acts as a natural blood filter, removing old or damaged blood cells and recycling their useful parts. Beyond that, the spleen is like a manufacturing plant for antibodies and white blood cells, which are crucial for fighting infections. When bacteria or viruses invade your bloodstream, the spleen teams up with lymph nodes to produce an army of immune cells to attack the invaders. But the spleen isn't just a defender, it's also a reserve bank for blood. In emergencies like trauma or heavy bleeding, it can release stored blood to help your body recover. So, while it's often overlooked, the spleen is a critical player in maintaining your overall health and balance. When your spleen is overworked or affected by an underlying condition, it can become enlarged. Common causes of splenomegaly include infections, diseases like mononucleosis, malaria, or hepatitis. Liver disorders, conditions like cirrhosis that strain the spleen. Cancer and blood disorders, such as leukemia or lymphoma. Autoimmune diseases, disorders like lupus or rheumatoid arthritis, where the immune system attacks the body. The symptoms of an enlarged spleen can vary. The most common signs include dull pain or discomfort in your upper left abdomen, sometimes radiating to your left shoulder. You might also feel full after eating only a small amount of food, or experience difficulty breathing when lying on your left side. In some cases, you might not notice any symptoms at all. This is why doctors often perform physical exams, ultrasounds, and blood tests to diagnose the condition accurately. The treatment for an enlarged spleen depends on the underlying cause. If an infection is to blame, antibiotics or antiviral medications might be enough to bring the spleen back to normal size. For more complex issues like cancer or autoimmune diseases, treatment can take longer and may involve chemotherapy, immunotherapy, or other specialized care. In extreme cases where the spleen is severely damaged or dysfunctional, surgical removal may be necessary. Fortunately, the liver and lymph nodes can take over some of the spleen's functions. However, living without a spleen does come with an increased risk of infections, so regular vaccinations and close monitoring are essential. Prevention is always better than cure. Here are some practical tips to maintain a healthy spleen. 1. Eat a nutrient-rich diet. Load up on colorful fruits and vegetables, leafy greens, and immune-boosting foods like garlic, turmeric, and medicinal mushrooms. Limit processed foods, sugary snacks, and fast food. 2. Take targeted supplements. Omega-3 fatty acids, milk thistle, and turmeric are known to reduce inflammation and support overall health. 3. Avoid abdominal injuries. If you play sports, consider wearing protective gear to prevent trauma to your spleen. 4. Get regular checkups. Routine health screenings can help detect potential issues early, even before symptoms appear. Taking care of your spleen isn't just about protecting one organ, it's about enhancing your entire body's performance and resilience. Your spleen may be small, but it plays a big role in keeping you healthy. By maintaining a balanced diet, living an active lifestyle, and staying vigilant with regular health checkups, you can keep this silent hero functioning at its best. If you found this video helpful, don't forget to like, share, and subscribe for more health tips and insights. Stay tuned for more content that empowers you to live a healthier life. See you next time.